Okay, so therapy interactions. Now, Peter Levine, who I've done SE, traumatic stress work, talks about co-regulation of the nervous system. I love that. So co-regulation, the therapist affecting the patient and somehow balancing their nervous system, right? John Upledger, craniosacral, talks about melding or synchronization with the patient. Oh. And then we've got R.D. Lang, psychiatrists, getting into their reality. I love Elizabeth Kubler-Ross's examples of sitting with the patient, expert on death and dying, sort of, forerunner of the modern hospice movement. She observed that some patients, they did the ward round, were particularly calm and looking really serene the next morning, and she tried to find out why. And well, the doctors visited all the patients, and there didn't seem to be a difference. And then she discovered, she really got down to the nitty-gritty, it was the cleaning lady. The cleaning lady said, oh yes, I just sit with them. I just sit with them for about 20 minutes. And she was blown away by this. These are the patients who were doing really well with this, dying process that can be very fearful over days. So she interviewed the cleaning lady and she put her in a position, above the doctors basically. She was training the doctors what this meant, what the sitting in consciousness with people meant, and what that could do for people. They didn't know the dynamics of it, the mechanisms, but it didn't matter. It worked. This practice of being calm and sitting just worked. So the energy interactions between patients has been, we're talked about in different ways for some time, right? And they say non-verbal communication's a different way of saying it. So from the therapist's point of view, we can be drained and we can be tired. We can be drained and tired. Psychologists talk about transference and countertransference. That basically means that supposing you know this from having lunch with a depressed or angry friend, you come away feeling a bit depressed and angry, don't you? That's countertransference. So this happens between human beings. We do find our emotions rather, let's say, infectious. So psychologists have words for this, but it's like the non-ordinary reality, the non-verbal communication that happens. And then the therapist, especially as an MD, might have premonitions and warning about patients, them being difficult, them not getting on with their medications just given them, you've just chosen the wrong thing, or you've missed something. So these are like premonitions that the therapist may get through this intuition. And then about the patient directly, the moment someone depressed walks through the door, most of us feel that. Most of us feel it. And we just know if someone's not in a good way, in a bad mood. We have a knowingness of an underlying emotional problem. The person who comes in with a sore back day after day, and you just know it's because they're depressed or they're really worried about their financial problems, and this is somehow affecting their physical health. And then thoughts and ideas might pop into the therapist's heads about that patient. This is intuition about their illness, perhaps. I know I've had the word blood pressure just pop into my mind with a perfectly healthy 35-year-old woman just pops in blood pressure. And I never check the blood pressure normally, but I did, and it turned out to be high. There's a simple example of things just pop in your mind. And why would one discount them? No reason to discount them, right? We're not fantasizing children. We have intuition for a reason. So there's a lot in this area. There is a lot of subtleties in the therapy basket, or the area of intuition in any business that we can really, really find useful. I'm going to tell you a story about that in a few minutes. But first of all, I'm going to move on to this area of nonverbal communication. This is my research on therapists. Have said that they felt like they were reading the patient. I said, how do you know that about a patient? I was reading them, and they can't describe what they mean, right? They can't describe it, the real mechanism, but they say, I was reading the patient, or I had a knowingness, I had a gut feeling. And businessmen always talk about their gut feelings, right? But I had a gut feeling. Something about me told me this man was really ill. All crying babies sound the same. That is so true. But this time, I saw sort of light above the baby. There was just something different. A female doctor said that to me. So it's really hard knowing when they're really sick and when they're not. And then someone said to me in Mexico last week, I said, how did you know what was wrong? She said, I just did the moment you walked in the door. There was a conversation going on between your body and mine the moment you walked in the door. There was a conversation going on. So therapists have these experiences. I think, and we all do so, right? We all know, if you walk in late and, your husband's waiting for you, you don't need to see their face. You can feel the anger radiating, right? Or you can feel the calm at the top of a mountain, the peace. So we all have these experiences of these felt senses of what's going on. And in my practice, I discovered, I use the example of a depressed patient, but some patients are just light and clear, and I feel it's like a shaft of light coming through. When you see, like, just right at the back there's a beautiful tree with shafts of light coming through. And that's someone's energy. It's clear and pure. But other times it may be polluted, like a polluted dull pond, with moldy leaves on it and murky and not clear. That's like how their energy feels to me.